But you're taller than I am.
You have to stand on your tippy toe.
I know. Hello, everyone. Good afternoon. Thank y'all for joining us. Again, we appreciate all the education we can get here. This is Miss Brenda Harper. We have worked together for many, many years. Dear friend, colleague. So I'm excited that she was able to come out and give some education on UTIs for y'all. So I will let her do her little bio and speak with y'all, and then I'm sure we will have lots of questions afterwards.
Well, hopefully I'll cover a lot of your questions, but yeah, I'm, as she said, Brenda Harper. I'm a nurse practitioner. I have been for, gosh, I hate to tell you, but at least close to 25 years, and then an RN long before that. And I have a master's in public health, and then that was my first original love, and then I kind of flipped into as a nurse practitioner and got a master's in science. So I love the teaching end of it, but I have to be with the patients. I love that. And so UTIs, I've been working in urology now for about 13 years. And so I see every day I'm in a different nursing home or a long-term or assisted living facilities, and I travel all over Texas. So I go down to the border, down by Mexico, and see patients down there. And so it's a countrywide, international problem, and I see it every day. So I welcome you. I'm so thankful that you're here. UTIs are really common, and the important thing is to recognize the symptoms early. And she's handing out in English and in Spanish the symptoms and what we can do about it, so that may also answer some of your questions. I also will go over a little bit about when to tell the staff. I know that that's another issue, is that you don't want to bother the staff. You don't want to, be worried about something if it's not really a problem, that kind of thing. So I'm going to go over that. And then also help you learn what the prevention measures are. And so that's what we'll be covering during this talk. So what is a urinary tract infection? Well, it's an infection of the urinary tract. And the urinary tract consists of two kidneys, the right and the left, and then you've got two tubes that come out of it. I had a diagram for it, and then I decided I didn't want her to have to print it in color for you. But I figured I could explain it, because everybody pretty much knows they got two kidneys. And they've got two tubes that come down that are called ureters. And then you have this little tube that comes out of the bladder then, because they connect into the bladder, then the bladder sits there, and then there's a tube that comes out to the outside, and that's the urethra. And unfortunately in women, it's close to the surface, whereas in men, it's not so much. So that's why you see more women that are exposed to bacteria, and it's easier for women to get a vaginal and also a urinary tract infection for that reason. The causation of bladder infections are E. coli usually, which is a bacteria that loves to spread, and generally it has many ways of getting into the bladder and contaminating the bladder. Part of why UTIs are common is that what happens sometimes is that the bladder doesn't always empty completely, and that's one cause of it. And you think you've emptied it, and you go, and a few minutes later you're back urinating a little bit more. The other thing, which is to me the most common that I see in every setting, is not enough water intake. And I get, it's so common that I give my lecture on water every place I go. Not only is it the lubricant or the oil, the 3-in-1 oil for the guys, for the body, but it also helps cleanse that bladder and keeps everything going out of the system and diluting the bacteria. So the lower the fluid intake, the higher the risk for urinary tract infections. And also, the less you drink, the less you crave it. So I hear all the time, oh, I don't really crave it. I don't really want any water that much. Well, that's because you're not drinking very much. But when you start drinking, your body will start telling you, oh, I want more water. Yeah, it's a funny thing, but that's what happens. The other thing is when you wear the pull-ups or you wear pads in your underwear, if you're trying to save money, which is the common thing I get all the time, I'm trying to save money, I stay in that pad or I stay in that pull-up and I don't take it off for a while because it's supposedly really absorbent. Well, the problem is it's still a damp environment and it can definitely cause urinary tract infections, and that E. coli will build up in there, and then it goes up into that, especially with women because it's right close to the surface and it goes right up that tube, and there you have it. For men, the enlarged prostate squishes down on that tube that we just talked about it kind of folds over the urethra, and it causes a backup of urine, and so you have incomplete emptying with a large prostate. Most men over 50 have some kind of enlarged prostate at some level of an enlarged prostate. So it's really important for men to drink water and to let the nurse know the symptoms, and we'll go over that in a minute. Postmenopausal women. This is another one that a lot of women don't think about, but once you don't have that menstrual cycle anymore, you don't have the lactic acid that keeps the environment down there acid, which kills the bacteria. And so because it's more alkaline, that bacteria is allowed to grow. And so sometimes what we do to treat it is we give a topical a topical hormone that will go down there, and that will help distribute that acid and make it acid again. And that helps a lot with urinary tract infections for postmenopausal women. So that may be some questions you have for that. Questions so far? Does that make sense? Yes, it's an estrogen-based, yes, and it's a cream, and it's usually used sometimes twice a week. It depends on how much big of a problem you have. You know, sometimes we put it even on daily. I'll just grab this. Oh, great. Common UTI symptoms. On your sheet, you have the list of the symptoms, and I will caution you that you're not going to probably have all the symptoms at once. Every once in a while you do, but it's a red flag to you to tell your nurse. And so the first one is burning or pain when you urinate. And a lot of times I get, sometimes I have a little burning, but not all the time. And then we find out that it's not from the bladder, it's really because they're not changing often and they have a rash, or they're, raw, a little bit down there. So other times when it's more consistent burning, that's probably the beginning of a UTI. Not always, but it's a good red flag for you to know that that's something you really need to tell Lucy or, your aide. Do they have aides? Oh, so you would tell Lucy. You would let Lucy know. Frequent urination. When I tell you to drink a lot of water, you might miss this one because you're going to be peeing more, right? Because you're drinking a lot of water. So sometimes you miss that one. But when you start, and it'll start rather suddenly, you'll say, I don't know what's going on. I was up 4 times last night, and I never do that. Or during the day, I couldn't even sit through lunch because I had to go to the bathroom. So that's a trigger right there to say, uh-oh, something's going on. If it wasn't happening that way yesterday, and suddenly you're starting to have that, and maybe it's combined with burning, you might have a urinary tract infection. So urgency is the other one. Like, get out of my way. I have to go. Don't stand there because I'm going to get there. And that, you really can't hold it. And that's another sign. Small amounts is a big problem. And that goes to show with the swelling and inflammation in the bladder, you will end up having, when you do have to go with the urgency, because you probably will have urgency with that, it's just small amounts, and you're like, God, I just went 5 minutes ago, and I feel like I got to go in, and then I'm only going a little bit of yeah. Itching usually is not a sign of a UTI, but it is a sign of usually a rash or vaginal discharge. And so that also is a red flag, but for something a little bit different. Yeah, it can be from a yeast infection. It can be, it's fungal, and that's really itchy. So, but that's a red flag for you to let Lucy know that, yeah, because we have powders and we have creams that work on that. And I see that all the time, by the way, the itching. So that's really important because it's for me, I think it's quality of life. You do not need all of this. You want to get it fixed and be done with it. Yes, ma'am. Yeah, some of them are. Yeah, some of the yeast ones can be over the counter. I don't know how they do it here. Lucy would have to talk about it, about how they would obtain, if you needed a prescription, do you set it up or?
So they have to see their primary cares because it's independent living. So they go through their primary care, or if they see Dr. Soria, I can usually help with Dr. Soria as part of that.
Oh, perfect. Yeah. So that's, but if you had like some itching, like at Walmart, they have an aisle full of vaginal and other kinds of creams and powders and all that. But the key is let Lucy know that something's going on with you, so that in case it doesn't resolve it, and because you're out at Walmart, you're out at HEB, HEB has it too. Grab it if you can, but let her know something's going on. I'm going to try to do it myself, but if that doesn't work, I want you to know I may need an appointment. And that way she can arrange that. Or you can call they call on their own, their PCP, right? You guys are independent. Lower belly pain, that's the pain that goes right down under here. It'll be an odd ache, and it's not up in here. It's always usually right over that bladder. So, so when you feel that it's like a dull ache, that's probably a urinary tract infection starting. Cloudy or smelly urine. The key to remember that one sign by itself doesn't always say it's a urinary tract. So I see cloudy, smelly urine all the time, but they don't have a urinary tract because they don't drink enough water, right? And so, or when you lay around a lot, and you guys are not the group to do that, but I have groups that lay around a lot. They have what's called sediment. The body, the bladder, sloughs off old skin, and that's what sediment is. It's just old cells, and it sloughs it off, and it comes out in the urine. And sometimes that colors the urine into cloudy urine. I've seen all kinds of colors come out, and yeah, so don't lay around a lot. Go make sure you go do your thing and get out there. But cloudy and smelly urine with burning, or the lower, pain in that lower abdomen area over the bladder, definitely, when you've got a couple of signs or more, boy, let Lucy know or call your PCP and get a urine. You don't want it, the key is not letting it go on, because it can get serious. I mean, it really can be a serious problem if you don't get it treated. Blood in the urine. So I don't know, a lot of people don't check when they wipe themselves, but checking is important as we age. Everything goes downhill over 50, I'm telling you. Over 50, it's downhill. So yeah, I would say it's good to always take a peek, make sure there's not blood on your tissue, and also with stool, make sure you're not getting frank bleeding or black stools. If you see that, you need to be checked. Yeah, because you don't want something going on that is going to just keep going on, and then you're way past the point of return. We don't want that. Questions about other symptoms? That's coming. It's symptoms in older adults. I'm going to talk about that. New confusion. Like if you're kind of, I call it wackadoodle. If you feel kind of wacky that day, and you're like, something's going on, I just don't feel right. Along with other symptoms, that can be a UTI. If it's only feeling confused, that could be the beginning of a stroke. It could be the beginning of several other things. But yes, you are absolutely right. That is one of the signs, especially in older people. And when I say older people, nowadays they say older people is over 50, but it's really, I see it more in the 65 to 70 range and up, where you'll get that confusion, sleepiness. You suddenly are sleeping and you don't know why. That's your body trying to repair itself. And so it's got an infection and it's putting you to sleep to rest. So sleepiness, you feel confused, you feel weak. There's a new level of you just don't have it in you right that day. And you're like, something's just not right. I can't put my finger on it. But I feel weak today and I feel just not mentally sharp. That's a sign. Falling, big problems with that. And we see that very often when a patient has a UTI. One of the first signs is a fall. And we're like, this patient never falls. What's going on? Because probably they were a little confused, got up to go urgently to the bathroom, and they tripped. Or they got their foot caught in the covers of the bed, or, a number of things. And since you have your own apartments here, be careful of those throw rugs, different things, the coffee table, whatever you have in your way of your bed to the bathroom, be careful of that. That's really important because when you look at it in your normal state, it doesn't look unsafe. But when you're confused, and you're just trying to make a beeline to that toilet at night, after midnight, you're confused. You're going to fall, and that's the last thing you need is a broken hip or something like that. So be careful of that. That is a definite sign that you might have a urinary tract infection going on. Decreased appetite. It doesn't take much sometimes to decrease your appetite. Depending on how they cook here. Are they good cooks? I hear that all the time, and to me, food is quality of life. You really want a good cook, So, but if it's a decreased appetite, not because of the food that was cooked, but because you're just like, oh, I feel queasy today. This just is, I don't feel right. Again, listen to those voices. They're telling you what you need to know and to tell Lucy what you need to know. And put the pieces together. Sometimes they're out here like this, and you're like, oh, I didn't think about that. Yeah, that's right. The night before, I was up several times, and now I'm at lunch today, and I don't really have an appetite, and I just want to go sleep. There you go. Tell Lucy. That's a behavior change. And you're your own best advocate. That's important. And the last one is sudden change from your usual self. And if anybody knows your usual self, it's you. And unfortunately, when you're feeling a little confused, sometimes it takes you a while to get around to that. But as soon as you can figure something out is not right, don't think it's a tiny piece of information and you're overreacting. It's better to let that information be known in case something comes out of it and you're more confused. And you can't help yourself then at that point in time, and you have to wait until there's a fall or something more dramatic happen that's going to take a lot more time to care for you than it would if we caught it early. So that leads to my next thing on there is when to tell the staff. Burning, pain, fever, or chills. Do all of you take your own temp? If you had a fever, would you take your own temp or would you go to Lucy? You take your own temps. Okay. So if you feel hot and flushed know that that's one of the signs. And usually by the time you have fever and chills, you've got a full-on infection. So don't, undermine it. Definitely just take your temp and see if you've got a fever. If you got a fever, PCP or talk to Lucy, let her know. Blood in your urine, we talked about that. New confusion. And men, especially when your wife tells you that you're wackadoodle today, you listen to them. Don't say, you're wackadoodle. No, because they're telling you the truth. Men are the worst in denial. I deal with men all the time, and they're like, oh, it's just a little thing. It'll be fine. They're strong, So that's why God created women, So, yeah, to let them know what the truth is. So sudden weakness, more accidents. So for those of you who don't have accidents especially, and you start having accidents, that's a big sign right there that something's going on, which means it may be something as simple, which is still not simple, but we can treat it, is overactive bladder. You may be getting this irritable bladder that spits out this urine, and it's not an infection. It could be something like that, but you can be tested for that. Back or side pain, that's another one that you may not know about. With back pain, many times it has possibly gone to the kidney. And you definitely want, if you start having this low back pain or onto the side, which would be flank pain, which they call it flank pain, that is a definite sign that kidney could be involved. And that, we don't want that bacteria to go all the way through the bladder and up the ureters into that kidney. That's pyelonephritis. Those are serious infections. So we definitely want to stop it before it gets to that point. The diagnosis and how we do it is by a urine sample. My team, I have an independent contractor team that goes in. That's how Lucy knows me. We go in all over Texas and we actually obtain a sample. We use these little tiny baby tubes, and they're infant size. They're not like the honking catheters that are at nursing homes and stuff. They're tiny, small tubes that we drain the urine, test it, and then we actually test the bladder for overactive, and then we can treat it, just like they would do in a clinic. But you're spared going to the urologist office for that. So that's how we did it, but you would be able to give a sterile sample, or as best we can get from you, and send it in to the doctor to be checked. And anything over 100,000 of the bacteria, they're going to treat. They're going to review the symptoms and see if you have 2 or 3 symptoms that you haven't put together yet, but are there to be able to treat it. And then bacteria without symptoms are not necessarily treated. And the reason is, as we age, we do colonize. And many times that you don't have any symptoms whatsoever, and these bacteria just live in there. And so if you've been treated for an infection and it's repeating frequently, and you don't have any symptoms, you just they just are checking your urine because you've had a urinary tract before, it may be that you just have the bacteria and you're not really going into an infection. And in that case, we don't treat with antibiotics, because if we treated everything with antibiotics, when something big came along, you would not be sensitive to those antibiotics anymore, and we don't want that to happen. So we want to be careful. And plus, at the same time, your immune system is under attack. And then we treat with antibiotics and it weakens that immune system, right? And then it has to build back up again. And so we want your immune system to recognize it and let you know. And so I see so many patients, and most of them that we don't treat are carriers of the bacteria, and they do fine. They're just a carrier. So, but if you see symptoms, anything, don't feel like you can't say anything. So what we treat them with, antibiotics, There are some patients occasionally that we do put on antibiotics daily, like minocycline or something like that, that they have constant urinary tract infections. They just reinfect themselves. And it's over 100,000. And those kind of patients, we would put on a daily antibiotic and keep that infection level down. We don't want it to go into sepsis in the blood, right? And then that can be life-threatening, so we don't want that to happen. The other big treatment for it is, guess what? Fluids. Pushing those fluids. And that means when you're sitting down watching TV, and especially now that we have such crazy things going on in the world, and we're trying to stay up with it all, make sure there's a jug of water sitting there and that you're sipping on it. Even if you can't drink a whole lot, if you sip on it, that gets it in. And what I tell my patients, I call it my sip and chip program. I say after 7 o'clock, do not drink. Take sips, even with your medications, because you will be up peeing through the night, which really messes up your quality of sleep. It's terrible. So you can suck on ice chips if you like the cold water, but really minimize that fluid, but drink a lot during the day. That's when you really need to do it. Now, I have those diehards that are like, I don't drink water. I don't want water. Well, here's what I tell them to do. Then what you do is at each meal, get an 8-ounce glass of water, and then whatever else you want to drink, and drink that 8-ounce glass of water at each meal. And then in between, if you can do some sips, that's great. Do some sips, but at least you've gotten in at least 3 large glasses of water. And there's not a whole lot of diehards, but there's a few out there for sure. And beer, whiskey, soda, coffee, tea does not constitute water. It's a liquid, that's true, and beer goes right through you. You only rent it, but but it does not do the same thing that water does. So I get asked that quite often, like, but I drink iced tea. Yeah. Or my wine. I have wine every night, but I haven't drunk water all day, but I have my wine. I never miss my wine. So I tell them, put a glass of water by your wine. You should still have your wine, but do your glass of water, Usually you will see improvement once you've been treated in 1 to 3 days. If you're not seeing improvement after the 3rd day, let Lucy know, gosh, I'm still having these really bad burning and pain. It may be that you are not as sensitive to that antibiotic and you may need to switch antibiotics. So it just really depends on your body, and they may need to check that. The other key thing that I see more than I would like to see is that when you get put on antibiotics, some people believe that once the symptoms go away, they're cured and they stop taking the antibiotics. That is terrible. You need to finish those antibiotics all the way to the end, and especially those that are 5-day antibiotics, because they are made to carry out for the next 10 days to 14 days. They're extended release ones. They're not just 5 straight days of antibiotics. It will continue to carry out. So after the 3rd day, if you're like feeling great, you're ready to go to the country western dance hall over here, wait. Take your antibiotics. You're still healing. Don't stop taking them. Keep going. Questions? Any questions so far? Okay. Yes, ma'am.
I have a friend that swears by cranberry juice. What's your opinion? She says if she feels one coming on, she drinks that, and then she's good to go.
Well, I'll tell you. Cranberry juice is like sugar in a glass. It doesn't do. You couldn't drink enough cranberry juice to make a difference. Now, however, there is a product. We've used it in every nursing home we go into, and it is a concentrated. It's called UTI Stat. and it's concentrated. It's expensive. It's not cheap. It's probably $1 a day depending on where you get it. But if you're prone to urinary tract infections, it may be very worth it. But it is a concentrate not only of cranberry, straight cranberry in a concentrated format, but it has D-mannose, it has all these other immune boosters that go into it, crammed into it. There's a whole readout on it. If you guys are interested in it, I can certainly get it to Lucy, and she can have that handout for you. And you can order it on Prime. It can be ordered. It's over the counter. Azo sometimes works and sometimes doesn't. It's not as good a product, I think, but it's not a bad product. I think you could try Azo. But cranberry juice, I think it's kind of all in her head. I hate to say it. But now, I also, yes.
Theracran, I think, is one of the product brands of the cranberry pill, but Costco also has their own generic brand that is very reasonable and goes on sale quite often.
You mean for cranberry pills?
Yes,
Yes.
cranberry
The
pill.
problem is when we see people substituting the cranberry pill for the concentrated juice, I'm okay with that, but they have to have in order to equate to the amount of cranberry that will be a preventative, they need to take 5 pills. It needs to be 2,000 and something. I actually calculated it.
Oh, wow.
Yeah, it needs to be 2,000 and something, and a lot of the cranberry pills are less than 500.
Huh.
So they
Yeah,
need to have between
is
4 and 5 a day. Most people don't want to take 4 and 5 along with all their other vitamins
No,
and their
that's the
pills and
truth.
medication. Yeah, so now the UTI stat is a little medicine cup, 30 cc's you can take daily, and it can be put in apple juice, it can be put in anything. But I get nothing for this from the UTI people. I just know it works. We've done studies on it. We actually did out in Austin, we did a nursing home where one hallway we used UTI stat because the doctors didn't believe us. So they said, let's do a study. So we did one hallway with UTI stat and one hallway without it. And we went to 0 UTIs on the one hallway. And the other hallway had their regular here and there UTIs. And so they were sold. Because it isn't cheap, but you have to invest in stuff that works, right? Because how much are you wasting when you get tons of cranberry juice or you get cran tablets? And I see it all the time. I don't know if you've seen it. They order 1 capsule of cranberry and 1 capsule a day. And it's a waste of money. It's truly a waste of money. But Costco does have it, and if you take, I think it's 2,500, something like that. I think you'll see some good results with that. The other product that I love is D-mannose. It's in a powder and also in a capsule. I like the powder only because when you use it daily, you can take 1 dose. Because you're prevention, right? But if you get a UTI, then you up the dose and you have it under your own, you don't have to go somewhere to a physician to tell you. It tells you right on the jar how much to take if you're getting symptoms of a UTI, and so you increase it right away.
Another nice thing with Costco is you go in the door and you tell them you're just here to use the pharmacy.
Yes.
And they don't have any extra charge for that at all. It's all free.
That's a great point.
So just keep it in mind. Just
Absolutely.
because you're not a member doesn't mean you can't use it. You can use it, and it doesn't cost you anything.
I'm so glad you said that because that's so true. And yeah, he said just to remind everybody that Costco, and I think Sam's Club is the same way. I think so. The pharmacies are free to the public. You don't have to be a member to go into them to use the pharmacy. The trouble is, I know Costco for sure is closed on Sundays, but they're open, 6 days a week. Sam's Club, I'm not sure on Sundays if they're open or not on the pharmacy. The Stone Oak one is closed on Sunday. Yeah, I know, because I've put in written requests, please open on Sundays. We're all here on Sundays. No, because they always ask for, people to put in their desires on what they want to see, and I always put that in. So, yeah, so that's a good thing to point out, that you can go. And D-Manos is really a good product, too.
How do you spell that, and what is it?
I'm sorry?
How do you spell D-Manos, and what is it?
It's a D-M-A-N-O-S-E. I think it's 2 M's, D-Manos. It usually comes like a D-M-O-N-S-E to M-O-M-M-S-E, D-Manos. And it comes in a pill and a powder. And it's an herbal, it's a combination of multiple things that block the symptoms and the E. coli. I know that, and then the UTI stat, it actually goes in and coats the inside of the bladder like Pepto-Bismol, coats the inside of the stomach, it coats the inside of the bladder, and the E. coli just slip off. They can't attach. And so that's why those products are really good. Yeah. Yes. Yes, yeah, you can order it from Amazon, absolutely. And you can usually get it within a day. So if you felt like you had some symptoms coming on, you can actually order it and start on the bigger dose, like D-Manos or the UTI stat. When someone has an infection or they've got some nitrites and leukocytes in their urine, which is the bacteria, I usually put them on it twice a day, the UTI stat, for 30 days, and then decrease it to once a day. The D-Manos is a daily thing, and then you increase it if you have symptoms. And I think it may be double the dose, and then you go back down after the symptoms kind of subside, then you go back down to once a day. It's a preventative. So that's something that you take all the time. Especially if you're prone to it, then you definitely want to be on something, because nobody wants a UTI. I mean, they're a real pain to have. They literally are a real pain, and they really drag you down. So prevention tips: drink fluids regularly. And remember, when you don't drink, you don't crave it. Your body will not even remind you to drink it because you don't drink enough. And remember that soda and tea and coffee, those are bladder irritants. They will cause you to pee more, you guys know that. Coke and everything else, they just irritate the bladder to pieces. So those are not in lieu of water. Do not hold your urine. If you need to go. I recommend every 2 to 3 hours, just get up and go. Empty that bladder out. Especially if you're drinking water. You'll be able to go and empty that. Keep the bladder as empty as you can. And try to sit there and empty it fully. Sometimes you'll sit there and that urine will come out, and then if you sit there a minute or two, you'll have some more urine come out. And as we age, we lose that elasticity, that things pop back. Same thing with the bladder, it's muscle. And so sitting there a minute allows that to keep coming out and emptying. So don't just jump up really quick, and try sitting there for maybe 30 seconds and see if more will come out. Good hygiene, that's another thing. If you're having problems with that, make sure you get your wet wipes at Costco, or you go, they're pretty cheap. H-E-B has them and Walmart has them cheap. So get wet wipes, make sure you're cleaning really good, and do not be cheap on your wet wipes. I mean stingy. That's the word I want to use. Make sure if you need 2, use 2.
So just plain old baby wipes.
Baby wipes, yeah. And I would not get disposable, because nothing should go down the toilet. Even the disposables, because they plug up they plug it up no matter what they say. They do, and then you're going to have all these problems you don't want either. Here's another one that comes into the cheap status. Change briefs promptly. Don't continue to wear them. And I know believe me, I know they're not cheap. The pull-ups and the poise and all the things. What I would say, a good rule of thumb is that if you're using pull-ups, and those are the expensive items, put a pad in there. And this is true for men too. If you feel like you are a heavy wetter, or you want to be able to not use one pull-up, but one pull-up a day because it's expensive and you're on a budget, I get it. I really get it. Use a liner. If you're not a heavy wetter, use a liner. If you are a heavy wetter, use the overnight poise pads. And that's cheaper than replacing those pull-ups all the time. So that's one quick fix for you. And you can get them on sale. They have coupons all the time at H-E-B for sure. And so try looking for sales and getting them when you see them on sale. That might help too. And then again, they're at Costco. They're at Costco.
For those of us who use the service over at the Air Force, if you have a prescription that is for, an antibiotic, they will fill it right away, and that they don't make, and you just have to wait for it to be filled. But I mean, it's nice that they will do that. Sometimes
Where is that?
Well, at the base.
Randolph, okay.
Randolph, yeah.
Okay.
So there's another thing. Nice
Yeah,
thing
that's great.
that you usually aren't aware that they will do that kind of thing.
Yeah, that's wonderful to know. And can you get at the base? You can also get products there, right?
Oh yeah,
Yeah, that's what I thought. That might be even cheaper to go there and get it, or have your neighbor, that you're friends with, if they're going to go, have them pick it up for you. That kind of thing.
Yeah.
Other questions? Yes, ma'am.
Discuss air in, it won't help my voice, air in the bladder.
Usually that's not typical, and that's atypical, and that is usually something that's not related to a urinary tract infection at all. That's a whole nother issue that probably your urologist you'd have to go into the urologist to see what that could be. It can be where there's a tear in the bladder. There could be several causes for that. I rarely hear that. So, there's always those unique situations that are unique to certain people, and but that is not a symptom of a UTI. So.
What did she say?
She said air in the bladder. Yeah, and many times it's not coming from the bladder, it can be coming from vaginally.
Well, I was told it was bacteria in the bladder.
Oh, that can cause air? Yeah, some of it can, but there's so many reasons why you could have that present. And again, sometimes because the actual vaginal canal and the urethra is so close together, it feels like it's coming from the bladder and it's coming from the vagina. So it just depends. It has to be really looked at. And what did they tell you to do about it?
Just take antibiotic because it was bacterial.
Yeah, it was in that case. Yeah, that's never come up as in my years of being as an infection.
I hadn't heard of it.
So that's good to know. I'll have to look that up. But questions? Any other questions? Yes, ma'am.
How effective are over-the-counter test strips if you are suspecting you have a UTI?
I think they can be very effective. You can use a test strip as long as you're reading the bottle correctly, and what looks like a UTI. Yes, I think they're fine. They're an added expense for you when they're going to they're not going to take your your test strip. They're going to redo it. But yeah, if you have test strips or you want to buy test strips just in case, you certainly can. Just make sure you're reading comparing the colors correctly on the bottle. Yeah. breathable clothing. You know, I see it quite often where, and we hate to say it, especially us ladies, but men too, where our clothes are getting way too tight. And we don't want to admit that we're gaining weight and we don't want to buy any more clothes, right? But when you wear these tight pants and they're clinging everywhere, and also not very breathable fabrics, like cottons are really breathable. You know, these cotton blends are really good. The jogging pants that have the stretchable waist and stuff are really good. But non-breathable type clothing like nylons, not nylon hose, I mean nylon fibers that are close to you, or underwear that are not like cotton based, and they're tight. You know, that leads to bacteria again, and uncomfortableness. So you might have to break open the checkbook and get some pants or something that are a little more breathable. That will help. That'll definitely help. And then men, definitely with men in particular, we want you to make sure that when you are seeing a change in the stream of your urine, if it's not coming out very much, if it's super crooked, if it's not, you're not urinating very much at all, definitely you need to let Lucy know that, because that means your prostate has grown and it's closing off. And many times we can use a medication called Flomax, and it's very easy to take. It's not a big pill or anything else, but what that does is it shrinks that prostate so that it opens up that tube and allows the urine to go through. So like I said, any males over 50 generally have some enlargement of the prostate. So don't be afraid to let Lucy know, or your PCP, that you think you've got some prostate issues going on. And they need to do a PSA anyway, which is a test that tests for prostate cancer. And that's a blood test. So they can test for that too, to see if you're at risk for, could it be prostate cancer. So definitely that's something that the men want to check out. Any questions from the guys about that? No? Okay. UTIs are common. I see it all the time. They are very treatable, and also they're preventable. So if you follow the things that are on your list and really look at them and see where you can make some changes, you will be able to pretty much prevent most of the UTIs that we see. And I would say, you know, it's not your fault. Only the one thing, in that you're independent living, you do have control over your water intake. And so that's a key right there, that most people fall down in. We just don't drink enough water, all of us, and medical people are the worst. So I'm standing up here guilty, because during the day I see back-to-back patients. So it's real hard for me during the day. So what I've done is I've started drinking tons of water in the morning before I leave. Then I make sure at lunch, when I go to lunch, I drink. And then at night I try to drink, which I try to stop it, you know, after like 7 or 8 o'clock at night. But I really try to put that water down, because I'm the worst about drinking during the day. And for me, I end up with leg cramps. So I know that I are not getting enough water. So that my body tells me, definitely. The key is telling the staff early. Don't wait. Don't think that your symptoms are minimal, and maybe if you don't think about it, they'll go away. They won't go away. So make sure you let Lucy know, your PCP, or, you know, don't tell your kids, because they're going to be on you. You know, they're going to say, Mom, Dad, like my daughter does, Mom, you know, you need to go to the doctor. So let Lucy know. Questions? Sorry about that. I had it on silence. I don't know what happened.
So do you recommend taking the UTI stat and the D-Manos all
No.
the time, or
No.
one?
No, take one or the other. I even put my hospice patients, I do hospice as well as palliative, plus I do long-term care. I put my hospice patients on the D-Manos because a UTI is uncomfortable. That's not quality of life to have UTIs. And so I use the D-Manos with them, and they do well with that. But I have a lot of people on D-Manos that take it prophylactically to make sure they take it daily, and they don't have any UTIs. It works really well. It's a great product, and it's not real expensive. Any other questions? Yes, ma'am.
What's the difference between a UTI and a kidney infection?
The UTI is usually in the bladder, and it's localized in the bladder. The kidney infection is up those ureters and into the kidney. And then what happens is then the kidney gets the pus and all the junk in the kidney, and that can go systemic even more so into your whole blood system and cause what they call sepsis or pyelonephritis, or that's the big fancy word for it, but that's pus in the kidneys and infection. So you're sick as a dog. If that happens, you're probably hospitalized with that. Walking is a problem because you're in pain. You usually have that flank pain, that low back pain, you're tired, you're wanting to sleep. You may not have burning with that if it's up in the kidney by that time, but you will have all the other symptoms. Fever is a typical one for kidney. That's probably more common than you usually don't get a lot with fever for bladder infection. So definitely know that a fever and chills is a big red flag. Somebody needs to know, that's important. Just for the heck of it, how many of you have actually had a bladder infection? There you go. There you go. That's how common it is. And so everybody knows nobody wants one of those. It knocks you out for a week, and you just don't feel yourself. So definitely let Lucy know. And if I made a word puzzle that you can do that has the symptoms to get them into your head. Here's the symptoms, and so if you want to do that to really push those words into your head to make sure you remember what it is that's going to trigger you to tell Lucy what's going on, or your PCP, whichever is easier for you. Definitely do that. And then Lucy's aware of D-Manos. She's aware of UTI stat. We've used him at her facility before when she was at a facility. So she can answer questions regarding that. And I can also send her information too that you're more than welcome to pick up from her on how to order that kind of stuff. You can, if you go under on Prime, you don't even have to do it on Prime. Just do it on the Amazon website if you don't have an annual membership of Prime, and put in UTI stat, S-T-A-T, and it will come up with a bottle. It's a bottle about this size, and it'll say UTI stat on it. And it has a generic now that's cheaper, by the way. It's got the same stuff in it, but it's cheaper, and I think that's called, God, I haven't used it in a while, UTI, it's in a green bottle. I can't remember. It's UTI, I forgot. But I'll send it to you. Yeah, I'll send it to her. But there's a generic form of it. And it may come up, when you look on Amazon, it may come up and say generic UTI stat. Or you can put in generic UTI stat and see what comes up. But yeah, make sure it's the same concentrated, good quality. Because in this particular case, you get what you pay for. And it's been so worth it to patients that are especially chronic UTIs. It'll knock it out. It'll knock it out. So, and it cleans up that bladder so nicely. So we're real thrilled with that product. So, yeah. Questions?
I'm not a water drinker.
Oh, see?
Iced tea. But they sell those little water flavors. Is that okay to add to the water?
Absolutely. And in Walmart, they have those big bottles of cherry flavored, mandarin flavored. So if you're not a water drinker, or you can flavor it. Absolutely. They also have a product that's IV hydration. It's in a packet that you just put into and it super hydrates you. Those are really worth it too. And it's called IV hydration, and they're in little packets that you can bring with you. If you're out and about with your kids and stuff like that, pop one in there, and it hydrates you. You can put it in different products, and it'll get you hydrated. So all that's really important. If I could point to one thing that really is the best thing to do, it's hydration. We see it all the time, you know. And I hear it all the time. But if I drink, I pee. Well, yeah, that's true. You know, so I hear it all the time. But that's why I say do it all during the day, so you're not up all night long doing it, and your body will also manage it and get used to it. If you're still peeing a lot, you may have overactive bladder, which also can be treated very easily. We have Myrbetriq, we have Gemtesa, we have several products that we use for that. That really works great, and it calms that bladder down, and you're able to hold it and still drink that amount of water. So there's lots of answers to that problem that says, well, I drink, I pee. So, and men especially don't want to pee. Men don't want to pee. So I hear that from men even more than I do women. So, they don't want to be bothered, you know. So, yeah, it is what it is. I'm not picking on you guys. It just is what it is. So, but don't ever feel like you're bothering anybody when you have to let Lucy know or anything. So she wants to know. Yes, ma'am.
My urologist asked me how many cups of coffee I drank. My urologist asked me how many cups of coffee I drank a day. I was drinking a lot of coffee.
Mm-hmm. It's a bladder stimulant.
And she said coffee and tea and soda are all bladder stimulants.
That's right.
You get what you put in your mouth.
That's exactly right.
Ugh. So I'm half a cup of coffee a day now.
Well, I wouldn't go that far. I would still say have your cup of coffee.
But things are much better.
Aren't they? Yeah. The first thing I do when I walk into someone's room is I look, usually even in independent living, you walk in and the kitchen is off to one side and then you see their living room. And the first thing I do is look around, and if they have like 24 cans of soda sitting there and they've got, I already know what one of the problems is, you know, because I can see it, you know. But I also believe in quality of life. Yes, we want quality of life. We don't want UTIs. But also, see, I would never go to a half a cup of coffee. I have to have my cup of coffee. So but we can adjust for it. And so I tell patients, you know, if you are having your cup of coffee, decrease it to that, or have your one soda. Don't have 4 sodas a day. Don't have 4 cups of coffee a day. Have your coffee though, and then make sure you're replacing the rest of them with water or a flavor. You know, something like, a lot of people I know, for some reason, I can't hardly look at it, lemon and lime, they put in their water. Yeah, they squeeze in their water and drink it that way. And so if that helps you, that's a good cleanser. It's great for that. So do that. You know, if you like the flavor fresh like that, that's wonderful. But get that glass down, no matter what. Yes, ma'am.
You said Gemtesa, that's okay to take that then?
Gemtesa is a drug that is bladder affinity only, and I use it on anybody that has heart problems because I don't want a medication to affect liver, heart, or anything else. I want it to go straight to the bladder. If you don't have heart problems, I've got other ones that are really good, Myrbetriq, Sanctura. There's so many, oxybutynin. Some of the side effects of that can be drier mouth, but usually it's in the higher dose. Some people are sensitive to it, and then I just tell them, get your chapstick, Burt's Bees, get a nice chapstick, and make sure you're rinsing your mouth, keeping your mouth, you don't want mouth sores. And hopefully a dry mouth might make you drink more, so that's kind of good. But yeah, it can cause dry mouth. But yes, Gemtesa, it's a newer drug. I don't have it work as well as I'd like to see it work, but it does work on some people. Yeah. So is anybody here that actually is treated for overactive bladder? Yeah, and it helps, doesn't it? It's helped you, yeah. So All of these things are treatable, but you have to let somebody know, definitely. Questions from you, or no?
I will say that I do keep specimen cups in my office. The lab supplies them. So if your doctor orders a specimen, you can always call me or
Oh,
come
that's
down and
good.
get one. So I have them in my office. We're trying to get the word out to the PCPs that aren't on campus that we do have the lab that will come here to pick up the specimens for you. So if you ever need that information, again, call me and I can give you the lab information, and the doctor can send orders to them, and they will come to they'll call you and tell you, what time they're coming, and then they'll come pick up the specimen or lab work, whatever it is, they can do that as well. So we do have 2 labs that will actually come here to the ARC to do that for you.
Do you give them directions on how to clean and everything to make sure that they get a good specimen?
I don't, but I can.
Yeah, definitely you have to clean well in order to give a specimen that way, and make sure that you're not touching the cup to you at all. It needs to be away from you and just pee into the cup, because you can contaminate the whole thing and then it's not worth it. So make sure you do it right, and then it should be a good specimen then that way. Yeah. So that means you have to have your wet wipes. Yeah, you need your wet wipes. You had a question over here? No? Yes, ma'am.
Brought a specimen from my PCP to the doctor, urologist, they wouldn't accept it. I had to give them one from there. Yes.
I'll be darned. Yeah, that's too bad. Yep, probably that, and also they want to make sure that they have instructions, and they're really tight on how they want you to clean, because it's so important that it be a clean specimen when it's not a catheter, getting it straight from the bladder. So it can be contaminated pretty easily, so we want to make sure it's not contaminated.
And I do not do catheters, unfortunately.
Oh, no, you don't? Oh, darn.
Space in my office for that.
Oh, we'll have to hit them up for an exam table. But yeah, so no, it's really important though that you do clean well with that, and then that's great that you have that service. That's a wonderful service to do. So, any questions about where to get products, what to do? Talk to Lucy about everything, or your PCP. And I think that I've covered most of it, or all of it really. I had a, you probably can't see it, but this is just a picture of the bladder down here and the kidneys. And you can see the ureters that come down into the bladder on both sides, and then that one tube, and so how easily that is to get contaminated, that urethra. It's just super easy to get contaminated. So just make sure that you're doing all those preventative measures, and chances are you're going to cut that cycle of UTIs down to nothing, and you'll be a happy camper. Nobody wants that. So anything else? No? Thank you so much. You guys were a delightful audience. I really appreciate it. I was going to tell you, I was going to give you
Thank y'all very
this.
much.
I'm going to give you this.
I did put her handouts over here if y'all would like any other handouts that she had.
That's the answer sheet.
Oh, you emailed it to me.
I did.
Yeah,
Okay, good.
I have it.
Yes, ma'am.
I'm on a whole lot of meds, cardiac meds, Ticasine, the defense.
Yes.
So is that okay to take the Urostat with that, or should I check with the doctor?
The UTI stat, you mean? Yeah, UTI stat. Yes, it's okay.
And the Defenilide also
Yes, it should be okay.
with anti,
Yeah, we haven't had,
Tomatoes.
yes, we haven't had, you don't have to take both. It's
Right,
either
right.
or. Yes, they're herbal that are not affecting cardiac. We have not seen that to be the case at all. Yeah, and we get lots of cardiac patients, so, yeah, that's why I like the natural product to do that with, if we can do it. And many times using the natural products, that can stop some of that urgency too, once you clean up the bladder.